Voice of Nagaland News Channel ge sobke swagat kuri ase viewers kan achi April 18 aro Voice of Nagaland News etia Welford Road yade Northern Angami Colony Dr. Belho la clinic te ahi gina ase yade American janibo pari daga do yade Dr. Belho clinic along with Nova IVF Guwahati Pace Canberra yade IVF laga opode ekta press conference rakhi gina ase yade American press conference se sai gina jaile do yede takambra misconception of IVF noi sugle do yede IVF laga opore yede confusion juli daga laga opore takambra clarify kurna ame hinge chanai dise not only that yede Dr. Belho kambra aro Nova IVF kambra ami kan ge janai dia do apni kan jidi enaga problem face kure ase aro enaga infertility laga enaga issue julia sugle do apni kan bahar de na chai gina nichor laga Dimapur te hi Nagaland de apni kan with affordable prices apni kan yede treatment lobo pare gunai do ami khan hunibo pare ase do viewers kan IB ami kan itu laga press conference laga obode details reports.
Thank you media for having us, and I am Dr. Masisen Belho, proprietor, managing director and consultant gynecologist here at Dr. Belho's clinic and children's hospital, and here with me is Dr. Raman, the specialist gynecologist of Nova IVF. He will later brief you regarding the infertility and other methods. And here we have Dr. Emmanuel, my partner and colleague, who helps me at the center. And thank you so much for being with us today. It is a very special occasion. Vishay khushi din ase aji, because especially after after many years, we are coming to this stage where we are able to bring affordable fertility techniques to Dimapur. And the most important thing about Nova IVF, I would say, is the accessibility and the affordability. And with that, I'd like Dr. Raman to continue in regards to Nova IVF. Nova IVF also here, we are happy to partner with them in Dimapur. Across India, there are many Nova IVFs now, even in Southeast Asia. And with great success, they have already attained 1 lakh deliveries with Nova IVF so far. And it is in collaboration with Nova IVF of Spain. And we are happy to partner with Nova IVF in Dimapur.
Thank you. Good evening, everyone. Respected members of the media and colleagues and friends. It's really a proud privilege on my part to be addressing this media on this very special day. Let me make a few quick points for the viewers that I am born and brought up in Dimapur. I did my schooling in Holy Cross School, and way back in 1982 I passed from Holy Cross, and then I was away studying for my medical courses and other things. I was in USA to do my fellowship in the year 2002, and then in UK for further studies. So today is a very important day for us, because we are starting IUI clinic here in collaboration with Dr. Belho's clinic and children's hospital. I am associated with this hospital owner, Dr. Belho, who is the senior Belho, and you will be happy to know that he was one of the pioneer of obstetrician and gynecologist of Nagaland. And I had the honor of working with him for a few months way back in 1992 in his old nursing home in the main city. So I learned a lot from him before I started my journey for my further post-graduation and all. So I had the pleasure of working with him. Now I have the pleasure of working with the second generation, his daughter, Masasino Belho. And hopefully I'll be continuing my association with them for the third generation as well. Hopefully one of her daughters become doctor and carries on with her legacy forward. Having said this, Let me give you a quick recap of the problem of infertility in our society. We had done a statistical data analysis of the incidence of infertility in Northeast India, and we found that 1 in 6 couples will face difficulty in getting a baby after they get married and having regular intercourse for 1 year. So this incidence is on the rise. So we exactly do not know what precisely is the reason of increasing infertility and childlessness. We did a few research and found that 50% of the cases of infertility lies with the male partner. Earlier, though, we used to think that the whole blame we used to put on the female partner. But now with modern technology and testing, we found that 50% of the cause of infertility lies with the husband and 50% with the female. Similarly, lifestyle changes have occurred of late. Increased use of smoking, drugs, and other substance abuse plays a very important role in declining fertility rates. We are living in an era where people get married late. This is one of the prime reason of infertility rates increasing, especially in case of women. Nowadays, women get married at later ages. They don't want to become mother very soon. They postpone their first child for a few more years. And by the time they reach 40 or 42 years of age, and when they plan to become a mother, their ovarian reserve decreases, and it becomes very difficult to conceive naturally. So this tie-up with Dr. Belho's Hospital and Children's Clinic and Children's Hospital is aimed at looking after the childless couples of Nagaland as such, where they find it very difficult to go to Guwahati and other higher centers because of logistics and the travel and the finances involved in staying there in Guwahati, plus the language barrier that happens in many cases. So we have decided that we will set up this IUI clinic here, and then we will give the treatment to the deserving couples. So IUI is a treatment where we take the sperm of the husband and we wash it and then put it inside the mother's womb. And then after the pregnancy takes place, she will be looked after by the staff of Dr. Masasino Belho and herself. She need not travel to Guwahati. The entire apparatus for doing an IUI, state-of-the-art apparatus, are already here in this hospital. So our main aim, which is our motto, is to do our job transparently and at an affordable cost, because most of the patients of our region are not well off to spend a lot of money. So we will be doing the treatment at the least possible cost so that it benefits all sections of the society. Simultaneously, we will also be starting IVF in the future. We have a plan of doing this, and right now, part of the IVF will be done here, especially the stimulation part, so that the patient's stay in Guwahati reduces considerably. So first 5 or 6 days of stimulation will be done here, and they have to go to Guwahati for only 7 to 8 days for the ovum pickup. So this is our step forward. We have put our footprint here, and we hope that the association of NOVA with Dr. Belho, Masasino Belho and her team continues in future, and we are able to serve the childless couples of Nagaland.
Just a curious question. Is there any long-term health risks for children born through IVF?
That's also a very good question. Most of the people have a myth that children born through IUI or IVF may have some birth defect or something like that. So let me give you a brief history of IVF. The first baby of IVF was born in 1978 in London. So it's almost 40 plus years. Till now, all the statistics and data have shown that there is no increased incidence of abnormal birth or increased rate of congenital anomalies in children born through IUI or IVF. This is settled once and for all. Rather, it was found that babies born through IVF are healthy, they are more intelligent, because the sperm that we select to do the IVF and the eggs that we retrieve from the mother's womb are of very good quality. So the resulting embryo is also very good. Sometimes in families where there are history of a congenital anomaly, like in family they have earlier children having some diseases, if we do IVF, then we can select the embryo. We can test the embryo before implanting it in the mother's womb, whether this embryo is also carrying that congenital anomaly or not. If the embryo is carrying that disease, we will discard it. We will not implant it. We will only implant those embryos which are good and which are genetically right to be implanted, so that the baby is healthy and doesn't carry the congenital anomaly that runs in the family.
So again, last question from my end.
Yes.
This question is for Dr. Belho. Since on a larger perspective, what we hear is that like IVF is an expensive affair. So like in your hospital, you have already stated that like it is going to be affordable for the couples, for the citizen. So does it covers under any government schemes where citizens can take advantage of that? Is it only like a private?
In the last conversation with the minister, the health minister, about a year ago, I had also put this point across that if Ayushman or CMHIS can cover IUI and IVF, so they are still in the process of accepting this one. We are not certain yet. They have not informed, and I don't know whether it is still, we will follow through with that, but whether it is implemented is yet to be known. But otherwise, as of CMHIS and Ayushman, we are hoping that at least 2 cycles can be covered. I had requested for 3 cycles of IUI and 2 cycles of IVF. So that will help our people. But we are still not sure whether that can be implemented. But it's in the, so we are bringing it down below 10,000 rupees per cycle.
Yes.
So which is actually like, a reduction compared to 20,000. And in terms of IVF, many centers are charging somewhere between 3 to 5 lakhs. So we begin with 1.3 lakh per cycle. So I feel that that is affordable when we compare it to the larger amount.
Last question then. Just a legal question. As we all know that like government rabi takan regulation egg konainan itu dibuang kan naga air di kan rabi aset. So abdi kan itu global lebih pero hospital lebih itu protocol follow berina illegal practices such as gender selection kan. Ina ka boleh ni boleh abdi kan ki.
Itu to beshi strict ase. Ami khan to whenever the patient comes to us, they will sign a consent form that they will never ask for gender selection, number 1. Neither we will entertain such a question, number 1. Number 2, we strictly follow the guidelines made by the ART bill, which was passed in 2021-22. So we have to submit all our records. Kun ke IVF korishe result aro result to ki hoise embryo kiman bonishe kiman jon successful hoise to the central lab, which is being monitored by the government of India, and they come for inspection to check our records. So we are very meticulously following each and every clause of the act. So that way we are very transparent, and we follow the rules very strictly. So you know that we cannot even tell the sex of the baby once they become pregnant. So there is no question of selecting the sex of a baby before the baby is born. So this is an absolutely no. Because the punishment is so harsh nowadays. Even earlier some unscrupulous elements used to do this. I'm not disagreeing with you. But now according to the act, there will be 10 years of imprisonment for the doctor, and that is a non-bailable offense. So no doctors will take this risk, or no center will take this risk of sex selection and other things.